In this segment, we're demonstrating a general warm-up protocol to get ready to do treatment for either golfer's elbow or tennis elbow. So we will start with some effleurage and petrissage. We are working on the whole arm and shoulder girdle, but the emphasis after the initial applications is really on the wrist flexors and extensors. So here we are doing some extensor work. This is broad cross fiber on the wrist extensors. Here's broad cross fiber on the wrist flexors. I'm going a little fast for the purposes of the video. You could do this a little more slowly. We'll add some stripping. If we're planning to do work for tennis elbow, we have more focus on the extensor side of the wrist, coming up across the supinator and the brachioradialis. Here's some loose fist stripping. Here's some flat thumb stripping. Same idea for the flexors. At the wrist, if we're focused more on treating golfer's elbow, these tissues need a little more prep and warm up to try to reduce the tension on the tendon. Here's some broad stripping and some thumb stripping. We could add a little passive stretching. And then we would position the client to apply the deep transverse friction treatment for either tennis elbow or golfer's elbow. Now that we've done the general warm-up for the whole upper extremity with special focus on wrist flexors and extensors, we can take a position to allow us to actually provide the deep transverse friction treatment. For tennis elbow, we would be finding the most tender spot and doing the friction work for that. So just for the sake of an example, we're going to be working on the myotendinous junction of the extensor carpi radialis brevis. So we palpate at the radial head, press our thumb with moderate pressure, maintain the same pressure, and then friction back and forth. And even though there's lubrication on the skin and on my hand, it's fairly easy to maintain pressure with no sliding on the skin, but moving the superficial and underlying tissues against the bone. So we have found the most tender spot, and we would keep this movement going for up to a minute the first treatment. In subsequent treatments, we could increase the time that we do the friction work. If we're working for golfer's elbow, we're on the medial side of the elbow. Once again, we're going to palpate the epicondyle. We're going to come just distal to it to apply friction on the myotendinous junction. So this is where I would be, but I would do it in a position so that the arm was relaxed and the elbow was not bent. So applying friction across the grain of the tissue. I'm using the pad of my index finger. I could brace a finger if I feel like I need a little bit of extra pressure. Notice I'm moving my whole hand and arm. I'm not just using flexion at the fingers. And we'd maintain that motion for about a minute.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.